COVID-19 cases are piling up here in Ohio, putting more pressure on doctors and nurses throughout the state. Health officials say 585 more patients were put in hospitals in the last 24 hours. This as the Ohio Department of Health reports more than 9,000 cases and 119 COVID-19 deaths since yesterday. Thanks for being with us tonight at 6, everybody. I'm Kerry Charles.
I'm Colleen Marshall. With those new records being set, one healthcare system here says hospitals in the state are approaching what they're calling a critical stage. So new tonight at 6, NBC4's Matthew Herchick spoke with them about the state of the hospitals in Ohio. And Matthew, what is their plan? Because these numbers are still going up.
Yeah, Colleen and Kerry, I spoke with the hospitals today, and they said that they are still having conversations daily about contingency plans that they have in place. But Dr. Gasato with Ohio Health here told me today that while the situation is currently okay, it's only critically okay. Now, just to give you some of the numbers regarding hospitalizations here in Ohio, in addition to that record high over the last 24 hours, you mentioned there are more than 5,200 people currently hospitalized. A number that's about a fifth of the total hospitalizations we've seen since the pandemic began. And hospitalizations have increased by more than 200% since November 1st, just 1 month ago today. Now, Dr. Gasato reiterated that all 88 counties in Ohio are currently hotspots for COVID. So as more COVID spreads throughout the community, the more it will spread throughout healthcare systems, not just with patients, but also among staff. And with burnout and fatigue a growing reality, the care for non-COVID patients remains a top concern.
We look at the capacity of beds in the hospital, the capacity of beds specifically for surgeries that would require a few hospital stays. If it gets to the point where we have limited beds, then a trigger that may have to be pulled is the cutting back or scaling back of surgeries that are requiring an overnight or a few day hospital stay.
Dr. Gasato said in addition to cutting back on elective procedures, they also have contingency plans in place to open up more beds for potential ICU patients if the number of severely ill patients continues to grow as well. Local for you in Columbus, Matthew Herchick, NBC4.